So hello pharma guys, welcome to my channel Easy Learn Pharma. So today I'm going to discuss about errors in prescription. That means what are the errors having in prescription? And second thing is for which purpose or what is the reason behind the errors in prescription? In the କୋଉ type of reason or ଆସୁଛି ଯୋଉଥିପାଇଁ for that reason so many errors are marked in the prescription. Okay, there are so many reasons are there, and that reasons by the physician. ଯାହା ବି କିଛି reason ଅଛି ବା ଯୋଉ reason ପାଇଁ errors ଆସୁଛି, and that reason is completely by the physician, or the physician ପାଇଁ ହିଁ such type of reasons will be developed, and so such type of reasons create the errors in the prescription, and that's why a pharmacist, it is very difficult to dispense the medicine to the patient by the pharmacist. Here, so the first problem is abbreviation, or the first error is abbreviation, and second one is the name of the drug, third one is strength of the drug, and fourth one is dosage form of the drug. Next one is the dose frequency, and last one is the incompatibility. So for that reasons, for such type of problems, or for that reason creates the errors in the prescription. Each of the reason by कौन हुए ना prescription error आसे. That's why a pharmacist, or that's why it is very difficult to dispense the medicine to the patient by the pharmacist. माने एई सब reason ପାଇଁ ଗୋଟେ pharmacist को बहुत difficult ହେଇ जाए medicine को dispense କରିବା ପାଇଁ, and it may or it in some times the pharmacist dispense the wrong medicine or wrong dose to the patient. Okay, so what is the first one is the abbreviation. So what do you mean by abbreviation, or what is the reason behind the abbreviation, or why the physician mentioned, or why the physician written or write the abbreviation in the prescription? Okay, so abbreviation means all of you know that is the short word, that is the short word. Okay, so I am giving one example so that you can easily understand. Suppose BID and TID, okay, and SS. Okay, so these are the abbreviation, and that abbreviation mentioned, or that abbreviation written by the physician. So for which purpose? Now, in order to save time. For the physician, the time to save kariya pai maximum time in the prescription, write or written the abbreviation words, or use some abbreviation in order to save time. So if the physician used some BID, so actually what is the meaning of the BID? So what is the meaning of the Latin words of the BID? That is the meaning of Latin words bis in die, bis in die. Okay, in the English meaning, that is the twice a day. Okay, so mention is an abbreviation. In that time, the physician used the abbreviation, that is BID. So what is the Latin meanings? Now bis in die. So what is the English meaning? Twice a day. That means you have to administer a drug 2 times a day. Okay, it means tor in die. Tor in die. Okay, so that is the Latin meanings, and in the English meaning, so that is the thrice a day. That means you have to administer 3 times a day. That the meaning होउछि कि तमे दिन को 3 times से medicine तमे खाई परिबो. That is the TID or taurine diet. Another in the SS means it is semis, SEMIS, semis. That means 1/2. That means 1/2. Okay. So if the physician use some abbreviation, or use some such type of abbreviation, if the pharmacist can read such type of abbreviation, or if the pharmacist don't know such type of abbreviation, so in that time definitely pharmacist give the wrong information to the patient, and due to some abbreviation. Clear? So that's why in the abbreviation having in the errors in the prescription. Clear? And second one is the name of the drug. Second one is the name of the drug. So in the name of the drug, so which type of errors having in prescription? According to the name of the drug ପାଇଁ କୋଉ type of error problem create ହଉଛି? Now all of you know he having some similarity in spelling, okay, having some similarity in spelling, and some of the drugs are there, and that type of drugs looks like same or some same sound. As for example, last time I am giving one example, that is Benadryl and Benazepril, and another one example is Digoxin and Digitoxin. Okay. So all of you mark the first four letters are same, yes or no, and same pronunciation and same sound. Benadryl, Benazepril, Digitoxin, Dioxin. Okay. So due to for that reason, sometimes what will happen, and sometimes the pharmacist can't read such type of medicine name, and sometimes the pharmacist can't identify such type of medicine, and that's why the pharmacist give the wrong medicine to the patient. Clear? And second one is strength of the dose. Okay, so strength of the dose, for strength of the dose, which type of errors having in prescription? Strength of the dose by କୋଉ type of error create ହଉଛି? Now if the physician are not mentioned their proper quantities of the medicine, ଯଦି ଗୋଟେ physician ସେ medicine proper quantities or strength ଯଦି mention ନ କରୁଛି, okay, as for example paracetamol 500 mg or 650 mg, okay, in the market the paracetamol tablet having in 500 mg or 650 mg, if the physician are not mentioned properly whether it is 500 or 650 mg, and definitely in that time the pharmacist give the wrong dose to the patient. Clear? And that is under the errors in prescription. So that's why a physician must be written proper quantities of the medicines. Clear? And next part is doses of the drug. For the doses of the drug, so which type of errors are being in prescription? या ପାଇଁ କୋଉ type ର errors create ହଉଛି? ଯେମିତି ଆମେ କହୁଛେ doses form of the drug. All of you know paracetamol available in the market in the form of tablet, in the form of syrup or liquid dosage form, okay, or in the form of injection form. That is also liquid part. Okay, acha. So all of you know कि the paracetamol tablet, sorry, all of you know the paracetamol medicine available in the market in the form of tablet dosage form, in the form of liquid dosage form, or in the form of syrups, or in the form of injection. So if in that place, if the physician are not mentioned which type of dosage form, whether it is tablet or whether it is syrup or whether it is injection, and definitely it may be cause a difficulty to dispense the medicine to the patient by the pharmacist. Okay, definitely pharmacist ପାଇଁ ଗୋଟେ challenge ହେଇଯିବ, definitely pharmacist ପାଇଁ ଗୋଟେ difficulty arise ହେବ. Okay, so to dispense the medicine to the particular patient. Next one is the dose of the frequency. Dose frequency means what? Now, if there is not mentioned how much time you have to administer, so definitely the pharmacist give the information wrongly to the patient. Okay, suppose the paracetamol tablet dispensed 2 times, okay, a day. That means 2 times, that means also 2 times, that means after food AF, that is the after food. So the सब information clearly mentioned ହେଇନି. So what will happen? Definitely the pharmacist give the wrong information to the patient. Clear? So that's why a physician must be clearly mention all the information whether the drug, whether the drug is a tablet or a syrup or injection, and the proper quantities, and in which time or how much time they have to administer the medicine. Clear? And last one is incompatibility. So, what do you mean by incompatibility? Incompatibility means what? Because before prescribing the medicine to the particular patient, the first role of the physician asks to the patient कि previously or ଆଗରୁ ବା history ତମର କିଛି ଅଲଗା disease ଅଛି କି ଯୋଉଥିପାଇଁ ତମେ ଆସ ତା ଛଡ଼ା ତମର ଆଉ କିଛି disease or problem ତମ body ଭିତରେ ଅଛି କି ବା ତମେ ଆଉ କିଛି medicine ଖାଉଛ କି so according to the disease or according to the medicines again the physician prescribe the medicine otherwise that medicine may be reaction to the another medicine if the patient having suffering from blood pressure having suffering fever having suffering from fever viral fever or having suffering from uh, diabetes. Okay, so in that time, according to some symptoms or according to the history of the patient, definitely the physician prescribe the particular medicine, and in that time the physician completely know that medicine can react to the another medicine because ये यहाँ पे medicine खाऊची, यहाँ पे मध्य medicine खाऊची, यहाँ पे मध्य medicine खाऊची. The physician से जब जो medicine जहाँ medicine से लिखिबो and that medicine should not react to the other type of medicine. So that is the incompatibility. Incompatibility means two or more medicines simultaneously administered and it will be react with each other. And that's why the action will be enhanced or the action may be enhanced or decreased. So that is the incompatibility. Okay. So these are the errors happening in prescription. Clear?